Do you suffer with repeat urine infections? This video will share 5 natural methods that will instantly reduce your risk of having another urine infection. Let's get started. Hi health conscious people, I'm Dr. Sylvia, a fellow of the Royal College of General Practitioners in the United Kingdom and a health educator with Askawayhealth. Thank you so much for clicking onto this video. If you love watching health information videos, make sure you subscribe to our channel and don't forget to hit that notification bell so that you know every time we publish new videos just like this every Thursday. Urinary tract infections are caused by germs growing in the urinary tract. They can be very distressing when they happen the first time. But when you've had painful urination, a fever with tummy pain or back pain, vomiting and other symptoms of a urine infection and recovered, it's doubly unfortunate if you have to go through these symptoms again within 4 or 6 weeks of recovery from the first one. We think that most infections happen because of germs passing from the anus and the vagina into the entrance of the urinary passage. However, in some people, when the infection keeps coming back, it might be as a result of an abnormality of the structure of the urinary tract itself. This could be as a result of a kidney stone or cysts in the kidney or even the development of kidney abscesses. But there are some other conditions that could also put you at a higher risk of having repeat urine infections. Examples are the condition diabetes mellitus, being pregnant, sex and having multiple sexual partners, as well as after the menopause. Now, before we jump into those 5 natural methods I talked about, let's quickly remind ourselves what exactly is the urinary tract. The urinary tract begins from the urethra, a tube that opens from the outside into the urinary bladder. In women, the tube is short and starts from the opening next to the vagina and passes upwards into the bladder. While in men, the urethra is longer and starts from the tip of the penis and passes all the way upwards to open into the bladder. Did you know women are 10 times more likely than men to get bladder infections because they have a shorter urethra? In women, germs can reach the bladder faster because of the shorter distance. And so the next part of the urinary tract is the bladder, which is the collection reservoir for urine that has been filtered by the kidneys. Next, traveling higher up into our bodies are 2 slim tubes that come up from either side of the bladder. These are known as the ureters, quite different from the urethra. And the job of the ureters is to transport the urine from the kidneys down into the bladder. And the final parts of the urinary tract are the kidneys, those precious, small but extremely powerful organs that filter away waste and toxic materials to create urine, but also produce important chemicals and hormones like vitamin D and renin. Renin is really important when it comes to blood pressure control. When we need to prevent urinary tract infections, the principal thing is to prevent germs from getting into the urinary tract or multiplying inside any part of the tract. Some people used to believe that the entire urinary tract is sterile. That is, that there are no germs or bugs living naturally at any point in the tract, similar to what you have for bugs that grow naturally on the skin. However, that's a myth. The urinary bladder contains a minimal amount of germs living naturally inside it. And so the only way to get an infection into the bladder is when germs from areas close to the urethra opening enter the bladder, or when the germs inside the bladder already start to overgrow. And what are these nearby areas? As we've said, the anus and the vaginal area are the most common culprit. Also keep in mind those minimal amounts of germs living naturally in the bladder. While they're usually protective, we're going to come back to how they can be implicated in preventing urinary infections. What what are those 5 natural methods that prevent repeat urine infections? 1. Hygiene. If you have repeat urinary tract infections, maintaining your hygiene is an essential aspect of preventing another one. It's essential to ensure that the area around your anus and back passage are always clean, particularly after opening the bowels. And using moist tissues or wipes are definitely preferred to dry ones for the benefits of your skin. Ladies in particular, after passing urine, make sure you're wiping from front to back and not the other way around. And discard any tissue after using it once. Closely related to all this, make sure you've always got on fresh, clean underwear. Change your sanitary materials frequently or before they get soaked, and avoid using vaginal cleansing products and douches or feminine hygiene products. Number 2 natural method is your diet. If you suffer with frequent repeat infections, are you eating a lot of acidic fruit? These are fruits like lemons, oranges, grapefruits, or tomatoes. And now I hear you thinking, how does what you eat affect getting a urine infection? Well, these acidic fruits irritate the urinary bladder, making it more difficult to recover from a urine infection. And some studies suggest that spicy food using sweeteners or caffeine in coffee can also do the same. The principal dietary change you must adopt to prevent getting repeat urinary infections is to drink plenty of water. A study showed that women who drank less than 1.5 liters of water a day were more likely to get repeat urine infections. Women who took double this amount, that is 3 liters of water per day, reduced the number of repeat infections that they had. What about cranberry juice? Cranberry juice is a popular natural remedy for urinary tract infections since forever. Some people swear by cranberry juice for treating their urinary infections. However, cranberry juice is not recommended as a treatment for urinary tract infections. Some urinary tract infections can be quite mild and go away without the need for antibiotic treatments. Taking cranberry juice in that case might not do any harm as long as you seek medical attention if things start to get worse or are not getting better after 24 or 48 hours. But can cranberry juice prevent urine infections? Well, the evidence that it does is limited, although some women think it helps them. And the 3rd natural method that you can use to prevent repeat urine infections is your clothing. Yes, what you wear can put you at risk of a urine infection. So avoid tight underwear made of non-breathing fabrics like nylon, rayon, polyester, or a blend of cotton and lycra. Tight-fitting jeans or close-fitting sportswear made from lycra material worn for extended periods should also be avoided if you're particularly prone to recurrent UTIs. And the reason is because these fabrics allow moisture to accumulate, which promotes the overgrowth of bacteria near the urethral opening. The best option for underwear if you suffer with repeat infections is one made of cotton fabric. Being one of the most breathable fabrics known, cotton offers airflow for drying out any dampness. In addition, cotton is a natural fiber that absorbs moisture instead of allowing the sweat to linger on your skin, encouraging bacteria to multiply. Number 4, activities that could make you more at risk of a urine infection. First of all, failing to wee or go to pass urine straight away after having sexual intercourse. Sexual activity, including oral or vaginal sex, can introduce lots of bacteria really close to the bladder opening from where it tracks upwards. And by going to wee straight away after sex, you can flush out the germs before they get the chance to start multiplying inside the bladder. We also recommend drinking 1 to 2 glasses of water straight after sex to help with flushing out your bladder. Secondly, some people get used to the habit of holding on to urine in their bladder for a very long period of time. It can be because you're busy working or exercising or don't think you're in a place where the toilets are clean enough to use. Well, if you're at risk of repeat urine infections, this habit really needs to stop, because doing so encourages the germs in your bladder to multiply if you don't empty it frequently enough. And number 5, natural remedies. We already talked about cranberry juice and its doubtful effect on preventing urine infections. But scientists have also looked at the role of probiotics and what they could do in preventing urine infections. Remember, we talked about the bladder having a small amount of germs naturally living inside it? Well, studies comparing the bladders of healthy women versus their counterparts with urinary tract diseases have found some interesting points. And one of them is that those at risk of having repeat urine infections tend to have less of these germs naturally living in the bladder. So the thinking is that by replenishing these missing germs that usually live naturally in the bladder, you might have fewer repeat urine infections. Probiotics can be found in foods and in food supplements as tablets or capsules or liquid form. The probiotics that will prevent repeat urinary tract infections need to be those that contain the lactobacillus species. While this is still an area under study, if you've been examined and there are no changes or abnormalities to the structure of a urinary tract, it may be of benefit to consider taking probiotics regularly for 3 to 6 months to help reduce your risk of repeat urinary infections. Well, my health conscious friends, thank you for staying tuned to this particular session. Hopefully you found it useful. Do let me know in the comments section, and of course ask any questions around the topic. Next time we're going to be looking at illness anxiety behavior, or health anxiety, also known as hypochondriasis. Could you be a hypochondriac? When do we say someone is excessively anxious about their health, and what are the implications? If you're interested in watching that video, make sure you subscribe to the channel, click the notification bell so that you know when we publish new videos. While you're waiting for that video to go live, don't forget to give this one a like. Check out these two here, and I'll see you again soon. Stay healthy.